Hi, and welcome to Alumni Hour. Thanks everyone for joining us. I can see that we've still got some participants trickling in there. So this, of course, for any of you who haven't attended an Alumni Hour before, is the series where we get to have in-depth conversations with some of the most extraordinary alumni that have emerged from the University of Melbourne. In particular, I should say, sorry, the Faculty of Medicine, Dentistry and Health Sciences. I should introduce myself. My name's Angela Lavoipierre. I'm a journalist and I'm a presenter at the ABC. It's been my privilege to host this series so far. We've spoken to some extraordinary people and today is no exception. Before we go any further, I'd like to acknowledge and pay my respects to the Gadigal people of the Eora Nation. They are the traditional owners of the land that I'm on today. I'd also like to pay respect to the traditional owners of the many lands that we're all on in our respective locations, to their elders past, present and emerging. We're very lucky today to be speaking to University of Melbourne alum Dr Ben Hurst. He's a medical doctor, but he's also the CEO of Australia's largest patient engagement platform, HotDoc. So there will be a bit of time at the end of the session that we're about to have for audience questions. So if you do think of something that you'd like to ask along the way, don't be shy, enter it in the Q&A function on Zoom and we will get to as many of those as possible at the end. First, I'll tell you a little bit about our guest. Before founding HotDoc, Ben Hurst completed his medical training at the University of Melbourne, of course, in 2006. And it's fair to say he's had a pretty unusual career path since then, which you will hear all about. He started out as a medical intern in Geelong and an ED resident in Warrnambool. He went on to specialise in psychiatry, and that included a period at Port Phillip Prison. After that, he left medicine to pursue a life as a novelist in New York. So lots of twists and turns there, which we will hear all about. It was in New York that the idea for HotDoc was conceived of. And then ultimately it was brought to life here in Melbourne in 2012. So welcome, Ben, and thank you for making the time for us.
Thanks, Ange. Really appreciate the intro.
My pleasure. All right, let's look at this long list of questions that I've got for you. Okay, so of course we have introduced you as the founder of HotDoc and we'll be talking a lot about that. But let's start at the very beginning. How did you first become interested in pursuing a career in medicine?
I think my parents very successfully brainwashed me. I was a somewhat naive 17-year-old, didn't really know any other profession beyond medicine. And I had learned from my mum and dad at the dinner table what it was like being a doctor. I'd managed to watch my dad operate on different ear, nose and throat patients. And it's kind of what I knew. And I guess I, at the time, admired my parents quite a lot. I still do, but it just made sense.
Right, okay. So from there, you had your training at University of Melbourne, and then you went on to become an ED resident in Warrnambool, ultimately then a psychiatrist at Port Phillip Prison. They're very different corners of the health system that you've touched. Maybe you could start by telling us, I suppose, if any of those appealed to you more than the other.
Yeah, I mean, if you look at my LinkedIn bio, it's that of someone, at least early days, who didn't really know what they wanted to do. And it's true of medicine. Even as I was going through as a university student, I found it such an interesting thing, but there was not one component of medicine that really sang out to me. And so beyond my sort of internship, as you know, we all have to do an internship, I didn't know whether I wanted to be a physician, whether I wanted to be a surgeon. I'm probably pretty sure I didn't want to be a surgeon. And didn't know if I wanted to be GP. And so emergency, it was this nice middle ground of let's expose myself to lots of different types of patient situations, work with lots of different types of health professionals and go from there. And then I was lucky enough, my friend worked at Port Phillip Prison and he was leaving, and he mentioned the job that he had, and it sounded amazing. He was running a 30-bed rehab unit in a maximum security prison, working with young people who had incredible life stories. And it didn't really sound like a medical job at all. It just sounded like, I don't know, just an incredible life experience. And so that was probably my first true awakening as a health professional, for what an amazing thing I could do, that really actually made me feel like I was having experiences with patients who I could help in a meaningful way. Emergency, I did kind of, it was incredible as there was such a diversity experience. Every day was different, but sometimes I did feel like I was more part of a larger apparatus than a health professional in my own right. So I think it was a great experience, but I think psychiatry was the first time I was like, this could really be something.
Right. And so it sounds like you were attracted to psychiatry, and then furthermore, the role in a prison, because of the capacity the opportunity to help people. You know, these are people who could potentially come a very long way with the right help. And I can see why that would be appealing. I guess I'm wondering how that measured up to your lived experience in that role.
It did measure up. That it takes. So there's obviously a certain number of people in the prison system who are just not good, and they really don't necessarily deserve trained health professionals dedicating themselves to trying to help their situations. But the majority of people in that situation are often very decent people who've had pretty crappy upbringings, and as a result, they've possibly embarked on situations where they've left home early and had to resort to drug taking as a way of dealing with their situations. And they all have incredible stories. And I think that's the thing that I tapped into, that I think maybe I started medicine in the first place, is like the stories that my mother used to liven the dinner table with. It's like, it was my first opportunity to hear those stories and to participate in those stories. And that's what was like, that was a really exciting time. And also, yeah, to make a difference. Those were young people who they'd made poor choices, but there were opportunities to give good advice, in some cases the right prescription, to make them sort of just take that better fork. So it was a really interesting job. Anyone on this call who's thinking about psychiatry, I would definitely encourage to consider forensic psychiatry. It's a really interesting area.
Yeah, and as you say, there is so much good that can be done there. So by this point, by the time you finished your role at Port Phillip, just brings up to speed, how many years had it been that you'd been walking quite purposefully down this path called medicine?
Yeah, this path called medicine, about 11 years at that point, 11, 12 years.
That's a lot of time. There's a lot of time to put into anything at all, particularly work that you'd found as meaningful. But you did decide to walk away at that point, right? What was it that, I guess, yeah, what was your mind frame at that point, and how did you come to that decision?
So I've talked a lot about how excited I was by that one role that I had. The truth is, all the way through medicine, it was always a bit of a struggle for me. I think I was a mediocre medical student, and possibly a mediocre clinician beyond that. I always found it quite challenging remembering, the 5 most common, signs and symptoms of malaria. Like, my brain wasn't configured to thinking in sort of like bullet points and algorithms, which some, is an important part of being a good doctor among many other parts. And so I think I felt that lingering frustration. I didn't know what it really was, other than I felt like I wasn't fulfilled being a medical student and being a young doctor. And I did find a certain, I was finding something else when I was reading books and novels by Dostoevsky and William Faulkner, and that was taking me to a certain place where I felt a level of excitement, and I wanted to emulate some of those people. And so, in spite of that really awesome year I had as a psychiatry registrar, I was ready to just take a pretty big leap into that creative unknown. And the idea of living in New York, being a novelist, I think I really romanticized the sort of that as this bohemian ideal. And I was like, I also had this sense of, you probably only get one or two times in your life where you're young enough, you have the resources to make a big jump and leap into the unknown. And it was a huge thing to do, but it was exciting. And I never finished that book. So even though I made this big leap, it actually ended up going nowhere, but it did get me on a different path.
Yeah. And I have to ask, and this is going to seem like maybe a bit of a frivolous question, and on some levels it is, but I also, there's a serious core to it. I guess I want to ask you how your parents reacted when you decided to walk away, because I suspect there may be some funny moments there, but also, it's such a prestigious career, and there is a lot of pressure put on doctors, particularly young doctors, and you've a lot of pressure you put on yourself, and you've invested all this time in what you've done. And so I guess, how did you sort of tangle with that, that pressure to continue? And
Yeah,
what did folks say?
I definitely, I would say that my mother and I had a few conversations over the years, both in med school and beyond, about my career direction. And so I come from a dynasty. It's basically genetic in my family line. Both my paternal grandfathers were also, both my grandfathers were also doctors. So I think it was a hard thing for my parents to get their heads around. And I think I definitely was the source of confusion and befuddlement. But equally, when I did make that leap, my parents were incredibly supportive. They definitely cried at the airport when I sort of waved to them at the gate and got on that 747, possibly because they thought I was going to New York and never coming back. But I think what they also knew is that healthcare had, even if I wasn't at that time planning to be a doctor for the rest of my life, there was healthcare had shaped my identity in a really important way. And I think they probably knew that then. And I think it's probably what has panned out in my life. But it wasn't easy. And I also while I think we had hard conversations, I think they were incredibly supportive when I did make that decision.
How fortunate. That's very lovely. That's a good story, I think. So it was over in New York, as we mentioned at the beginning of this session, that you had this idea for HotDoc, and I want to ask you about how that happened. But first of all, maybe you could tell us a bit about what exactly this platform is. I mean, has to be acknowledged that statistically quite a few people watching tonight will have engaged with it. So a lot of people will have a good idea, but for those who don't, give us the elevator pitch, please.
Yeah, sure. So elevator pitch is, in its very first incarnation, HotDoc was a way for patients to make online bookings with health professionals. And it was a good thing because waiting on the telephone for a long time sucks. and sometimes you really need to secure a booking after hours. In the 7 years that HotDoc's been going, or the 8 years now, it's turned into more than bookings. We've kind of looked at each step of the patient journey, and it's about being recalled for an appointment, booking an appointment, checking into the waiting room, maybe being reminded for an appointment, seeing where you are in the queue. It's about trying to help medical centers communicate much more effectively with patients and enable the best possible patient experience.
And improve care pretty substantially by the sounds of things as well, if you're able to kind of remind people when they're due for something, a checkup.
Absolutely. It's like, for us, the two most important, I guess, fundamentals of healthcare are strong relationships between patients and their providers and really good communication. And that's like, whatever we can do to help build stronger relationships and help make communication an easier process, that's where HotDoc believes it can help.
So take us to the very germ of this idea, how it, was there a lightning bolt moment? How did it come about?
Yeah, there's two stories. One's really lame and superficial, and the other one is hopefully a bit deeper. The lame superficial one is Ben in New York, a bit disappointed about the idea of traveling back to Melbourne with an unfinished novel, tail between legs, run out of funds. And on one of my final nights, I was in a bar called the Kingswood. It's an Australian bar, weirdly. And a friend who was doing a MBA at Columbia was trying to make me feel better and mentioned this company called HotDoc. And they enabled patients to make online bookings with any provider in New York. And they were spreading like wildfire across New York. And he just, as he was narrating this company and this idea, it was this lightning bolt. It was like, this is such a simple idea, but with such profound implications for the patient experience. And I guess I quickly pieced together that I knew a lot about the experience as a general practitioner, as a business owner. And I could kind of start filling in these gaps of how to solve that problem in Australia. The more meaningful answer is back to the parents' dinner table. I remember as a teenager listening to the stories of my mum and my dad, mum in particular, who was running her own GP business and trying to get it off the ground. And just the challenge that she went through to try and run a business, hire receptionists, get the front office working, make the accreditation work out, like running through all this red tape bureaucracy. And that's not what she was about. She was just about being a doctor. And so the true genesis for HotDoc is helping doctors just be great doctors.
Yeah, I mean, that's a important idea, I think. And I guess I also wanted to ask about what it is about, like how it is you're able to, using the platform that you've built, what is it about it that is that helps foreground and elevate the kind of patient-doctor relationship? What's the kind of, how is it different, I suppose, from experiences people might have had booking and connecting with clinicians else in other ways?
The persona or the patient experience I always thought about when we were trying to get HotDoc in the ground was a young mother with maybe a 6-month child who has a fever, and it's like 11 p.m. and she's wondering whether or not she should go to the emergency department, a half an hour drive, with the expectation probably wait for 3 to 4 hours in the waiting room. And then upon seeing a doctor, finally be told, take some Panadol and go home. And what a terrible kind of decision moment that would be, to kind of go, I know that this, like, I don't know what's happening, but I have no other way. Like, this is the only sort of method of getting treatment soon. And then I thought, well, what if that person was able to secure an appointment at 9 a.m. the next morning with their usual doctor? Like just that peace of mind. And so I think like it's small moments. It's that ability to make being a patient, like being a patient's not great. Like no one likes to be sick. No one likes a sick family member. But if you can make it a little less painful and a little easier, then that can elevate their experience and hopefully also impact patient outcomes for the better.
Yeah, and sort of maintain that trust, and so you don't have a patient incredibly frustrated at the outset and develop that kind of negative attitude towards care that you kind of see with people often. But look, I wanted to ask about, I guess it strikes me as and I hope you don't this is intended as a compliment rather than anything else.
Sure.
It's a very simple idea, right? That's its beauty. It's kind of, as you say, you kind of, it's it's a good idea when you have it and you kind of go, oh, well, how does this not already exist? This is something that should obviously exist. So I wonder about where it grows to from here. You mentioned that there have already been a few avenues for growth, but yeah, what happens, say, in I don't know, 10 years time? Do you see this platform operating in a radically different way or in an extended way?
I hope so. At the moment, like if I think about what it is that we've achieved, I think HotDoc has done a great job of helping patients connect much more easily with their general practitioner and their medical center. And that's like, we're all really proud of that. As I think we all know, one of the real frustrations of being a patient is that you have more than just your GP. Often you have, if you're a diabetic, you have an endocrinologist, you have a podiatrist, you might have an exercise physiologist. And it's great to book with, one of them or maybe two of them, but wouldn't it be amazing if like you could know who your treating team was, and it would be really easy to share information between them and also have them share information and all be on the same page. So I think that the broader vision of HotDoc is to not just make it easy to book with your doctor, but make it easy to manage your relationships with your treating team and therefore manage your healthcare.
How's COVID changed the game for your business, or has it even?
It has, in sort of, it was a bit of a shot from the dark, as it was for everybody. We were like pretty excited about our plans to start moving from GP to these other spaces, and suddenly it wasn't such a pain point to book with your specialist. It was a pain point to get tested for COVID. And so very quickly, and not just that, actually, at a point, there was the only way that you could see a doctor was via telehealth. So when the outbreak happened, very quickly, we dropped what we were doing and tried to enable telehealth functionality so that patients and doctors would be able to have remote healthcare appointments. And then we also work quite closely with the government to build respiratory clinics, which would make it really easy for patients to secure an appointment slot, to get a test. And then more recently, we've built a vaccine module, which has made it easier for patients to make a booking, get a vaccine, get information about all the stuff associated with getting that vaccine, and also getting recalled for the right amount of time, depending on what that vaccine is. And we've, since building that, which was honestly like 5 months ago, we've now had 4 million appointments come through. So yeah, I guess it's an exciting part, or exciting time for us, because we're helping a lot of Australians get vaccinated more easily.
Yeah, I don't think I realised going into this interview that you had found yourself at the forefront of the vaccine rollout, which is the focus of so many people's attention. I'm sure everyone, watching tonight. as a journalist, there are so many questions I want to ask about. I guess what it's been like, and but you can steer this because we you know I'm really coming, as you say, a shot from the dark with this one. But has it been a difficult process at all? I guess wrangling what is a massive lumbering like national, it's a vaccine rollout is very difficult. There's been a lot of criticism of how quickly or slowly it's happened, and as if everyone loves to criticize from the couch. But yeah, what have the specific challenges been in doing a massive national, being involved in a massive national rollout like this, particularly with government, which can be an unwieldy beast, as we know.
Yeah, they certainly can. It's kind of good that this is like a closed forum, because I think it's quite easy to be candid about some of the experiences that we've had. It's been really tough working with government. A lot of the work that we've done has been unpaid, and it's quite challenging sometimes when you're running a business with over 100 employees, and you know that the right thing to do is to develop a solution that's going to help GPs and patients get better access to vaccines, but you don't have a good way to fund that, and you try very hard to work with the government to make that happen, but it's never easy. Like it's never easy to react really quickly to a pandemic or any sort of life-changing event. So that it's definitely been hard, but what's been interesting, like the company is sort of like, we were focusing so much on specialists and allied health is like, that's the goal. And we've struggled in that area because like the aspirations of the country or the challenges have changed. It's about getting the nation vaccinated. And so what we thought was going to be the success of the company is so different. The success of the company is much more now about helping patients and having more patients who download our app and making bookings. And in the last 12 months, we've had double the number of patients use HotDoc, which we never, like, that was never intended. This is sort of like, this is not by design. So it's like, it's been this weird period where we thought, the business is kind of struggling a bit, but then we kind of realized, oh, wow, like we're doing better than we ever thought we were. We were just kind of looking in the wrong place.
Yeah. Okay. So it's been an incredible period of flux for you. I guess I wondered, do you think you'll ever kind of get back on that initial track? I suppose we're all not only looking down the barrel of we're less than a fifth of Australia has been vaccinated at this point. Once that's done, we expect that there could well be years and years to come of boosters. And so it's kind of one of those Harbour Bridge jobs where by the time you finish painting it, you need to start again at the other side. Do you just see yourself continuing in that space? And do you think is it going to come at the expense of these other visions that you were talking about?
Yeah, I think that's 100%. But I think that's okay. Like, that's kind of at the heart of being a decent entrepreneur, is being able to adapt to new paradigms. And what we thought was important 18 months ago is not as important as other stuff. I think, like, COVID is here to stay, and also telehealth is going to become only more and more important, and so HotDoc needs to adapt. And while we're kind of doing some cool stuff, getting patients to access vaccine bookings, that's hopefully one of many other things that we can do to enable better patient experiences.
Ben, we're getting some really good questions coming through. Anyone watching who is thinking of more, please do share them. We're going to come to them very soon. I suppose you mentioned just now that obviously you had to be very adaptable. We all had to be adaptable, but you ended up being incredibly adaptable with your business as the pandemic hit. And you've taken a couple of big risks along the way as well, just to even get to the point you've got to, and to start a big business from scratch, having walked away from medicine. I suppose a lot of people watching, particularly students, might be wondering if their career will be as twisty and turny as yours has.
I wouldn't recommend that.
and I suppose, yeah, what I want to ask about the confidence trick. How do you find the confidence to make those leaps? What's the kind of, how do you think about it? How were you able to make those jumps at crucial moments that you have along the way?
So reflecting on my own career trajectory, the hardest thing I ever did was leave medicine to go to New York. And there's so reflecting on this, it's madness. I still can't understand why I made those decisions. I kind of know, but I kind of don't. But having done it once, the next time it was much easier. The idea of thinking about me being an entrepreneur and trying to build a business, it was entirely rational because I'd made a big risk once. And so thinking about some of the people in the audience, the incredible thing about any healthcare degree is that it is such an amazing ticket to play, not just to become a healthcare professional, but to have this incredible knowledge and have these really amazing experiences where you get to work with patients, you get to learn from other health professionals. And healthcare is just such there's so much exciting disruption that can happen in that space. So I think there's it's if I was a student today, I think I'd still be excited about the idea of being a health professional, but I'd also be excited about where else that can go. And I think that's 50 years ago, that probably wasn't the case, but today you can do medicine, you can be a doctor, you can be an entrepreneur, you be a biotech researcher. There are just so many ways that you can take that incredible gift and turn it into something really exciting.
Yeah, absolutely. Yeah, so it's as if you think you're learning one thing when you undergoing training to be a doctor and then practicing as a clinician, but you're learning all these other things you don't quite realize along the way, and probably some leadership skills as well. I'd imagine too, which have been brought to bear in your role as a CEO.
Yeah, it's leadership is weird. I still remember the first moment where an engineer, I was disagreeing, one of my co-founders even, and he didn't want to do what I thought we should do. And in the end he said, "Oh, well, you're the boss." And it was the most it was this epiphanic moment because I didn't even know what that meant. In healthcare, often, especially in the hospital system, you're just working together in teams, and sort of, yes, there's a hierarchy, but it's a little bit different. And I think it definitely, that was a moment in my life. I was like I do have this weird position, and now I'm going to have to learn about leadership. But then afterwards I realized, yeah, healthcare does teach you about that as well. The most important things to be a good leader are to be a good listener and to be decisive, to be able to synthesize information and communicate it back simply. And those are skills that you learn all the way through healthcare. So I think weirdly, it does teach you to be a good leader, even though a lot of what healthcare, the standard healthcare professional might not consider themselves a leader.
I'm going to start bringing you some of the questions from the audience now. There are some really great ones. I actually wondered about this myself. Ben, what's your view on overcoming the privacy hurdles in expanding the reach of HotDoc, particularly in light of e-health records, and at times there's been a great deal of, I suppose, community concern about that, and that's a suspicion of the public sector. So you'd imagine that those concerns would be I suppose, increased, if anything, working in the private sector. How do you think about that challenge?
Uh, I think about it probably in two ways. First is about security. So right now, or like 20 years ago, patient walks into a doctor, gives their clinical history, and that information then gets stored into a medical record that's held on site. That's obviously a much more secure, like you've almost got a firewall just by the dint of it being in a geographical location than that information sort of being stored online. So the first thing is, if you're going to participate in this space, you have to really invest in security. That is important, because if you don't do that, and there is obviously nothing is bulletproof, but if you want to do everything you can to make sure that there's not a break. So that's just it's probably not at the heart of the question, but it is really important, and it's something that we care deeply about. The second thing is, pretty early on, HotDoc had a company promise, which was very aligned with the Hippocratic Oath about what we were going to do and what we weren't going to do, and very much based on the do no harm principle. And so I think if you are going to handle patient data in any way, it should be based on some pretty important principles. You should handle the absolute minimum amount of data that you can to deliver the service that you're hoping to deliver for that patient. And you should only handle that data in a way that helps that patient and not helps the business. So you shouldn't use information about the patient as a way to sort of help you target that patient with specific advertisements because you've learned something. That's not helpful to that patient, and certainly not helpful to that doctor. So the way we think about it is really important security, and then really important principles, and then working hand in hand with our customers and lawyers to make sure that we have a set of privacy principles that mean that we're providing the service that we can, but we're doing it in a way that doesn't risk patients in any way.
Yeah, see, I suppose what I'm so interested to hear you talk about there is that it's your principles that have guided a lot of your method, because there is strict privacy law in Australia, but it sounds as if a lot of what you brought to bear on the decisions in that arena was to do with what you chose to. There would have been the opportunity, for example, to be a lot less scrupulous and maybe take some advantage for the business.
Yeah, I think that's why HotDoc has been successful. It's very much tried to align itself philosophically and with the right values of healthcare professionals and patients. That's the first thing. The second thing is to be compliant. It's sort of, if you want to be an ethical, values-driven company, you should define that yourself. You should be the architect of that. And then you have to be compliant. You have to abide by all the privacy regulations. But it's that should be kind of the second order thing, not something that you need to do to run a good business. So I think that's what we've probably done pretty well.
Yeah. So I'm so interested to hear the extent to which it's choice, but yeah, that makes sense the way you put it. A question here about the matter of disruption, which is something that you've talked about before. Ben, the relationship with a treating team is definitely an area that could benefit greatly from innovation. If I have a GP, psychiatrist, and psychologist, there is tremendous friction in getting these professionals to work together, share information, and create and execute a well-coordinated plan to improve patient outcomes. Oh, wait, that's just an observation rather than a question.
I agree.
Very good one. What was the question? I suppose to tie in another question that someone else has asked, it's it is difficult to get all those different people to talk to each other. I know this from the patient side than anything else, especially if you've got a complicated health profile or chronic illness, it can be absolutely diabolical, and you have to be a professional at it yourself almost. And there's a reason that it's hard to get all those professionals to talk, I think, because everyone's got their own way of doing things and their own ideas about privacy and what to share and what not to share. How do you plan to overcome those natural barriers? And have you done much consulting with specialists and clinicians themselves as to how best to do that?
Yeah, we have. I'd say we're at the start of our journey, and so we're learning a lot every day. I guess the thing I've probably learned over the last 8 years, and maybe something that can also be drawn from the tribulations of, say, the electronic health record, is that a good idea is not enough. Like the way that you execute on a good idea is aligning incentives. And while it's a nice idea that doctors will try and upload information to this place so that people can more easily be on the same page, they're not going to do something that isn't right by them and that doesn't make sense to the patient and they can't obviously see is going to enable better health outcomes. And so I think, like, back to your question, like, the way to get through this is to talk to GPs, is to talk to psychologists and psychiatrists, and less so thinking in a solutioneering sense, but more like, what are their problems? Like, what are the pain points that they're experiencing? And I think for something that I've learned recently through doing different focus groups and talking to those stakeholders, a real challenge in healthcare is matching. It's like, doctors don't just want more patients, they want the right patient. And different psychiatrists and psychologists, they have many different types of subspecialties. And if there's an easier way where GPs can know about that in advance and make really good referrals, then those specialists are going to be much happier, and they're going to be incentivized to consolidate the relationship with those GPs by giving, really good communication, discharge letters, whatever it might be. And that's something that, you can kind of point to as like, let's try and solve that problem, rather than let's try and solve this massive problem of communication between health professionals. So yeah, I think, like, this stuff is hard, but the best way to start is with the pain point and the problem, and by focusing on something that's kind of small that you can kind of take a small bite out of, as opposed to this just like huge nebulous like interoperability challenge.
You're quite a way down the path with HotDoc now, and we're talking about what is now a very successful and large business. I suppose I wonder if there were very difficult moments along the way, particularly in the early years, where you felt like your faith in the outcome was shakier than it is now.
Oh, absolutely. There were times, like, as an example, 6 months in, I'd invested all my money. My parents had put in quite a bit of their super. Most of it was gone. We probably had about 2 months of runway. And my friend, who was a journalist at the Business Spectator, called me up and he said, this press release has just fallen on my desk, you should take a look. And lo and behold, our biggest competitor, who is like nascent like we were, had just raised $10 million. And that was a moment where I just like, it was like the apocalypse of my business life. And that was one time. It probably happened a couple of other times. And I think that's just what you have to sign up for a little bit. It's just like, there are going to be these moments where you just think, this is unsalvageable. I don't know what to do next. But in the next moment you're dusting yourself off and you're like, well, hang on, we're different to that other company. We're trying to do this good stuff over here. And if we just keep like persisting with our plan, then maybe we can just like climb up this ladder a little bit further. But yeah, like there are tough times, and like if you're going to be an entrepreneur, you have to be comfortable with the idea of being on a bit of a roller coaster, which is like exhilarating and also very painful, but they kind of even each other out. And so if you're smart enough to know at the exhilarating moments, this is actually not that good, and at the worst moments, this is actually not that bad, then you often get through.
More questions about, I guess, the functionality and growth of HotDocs. So you've spoken about the way that it's being used and how you imagine it being used, and now you've moved into this sort of vaccination space. You've had a lot more to do with the public system by the sounds of things. Do you ever see it being a useful platform in larger hospitals and moving into that setting?
We have an investor of ours is Ramsay Hospital. So they believe that one day a HotDoc will be able to really help them play a role, not just when a patient walks into the hospital and walks out of the hospital, but a broader role. So I think the answer is yes. We've also recently built some relationships with St. Vincent's and Austin to help them manage vaccinations, both in hubs, and manage the vaccination of their staff. But equally, I think we need to be pretty focused, and it can be very inebriating to think about all these possible opportunities, hospitals, insurers, governments, patients. Like, I think it's important that HotDoc just like we keep focusing on what we do really well, which is we work really well with general practice medical centers and increasingly other types of health providers to help them engage and provide really great experiences for their patients. So that's our focus. But this sort of other stuff is like, it's exciting, but we probably don't want to dive in quite yet.
I'm just going to try and make my way through this question. It's too long for me to know where it's going, but we'll all find out together. Many practices are corporate structures now, and often the practitioners, being virtually salaried, tend to move around a bit. How does HotDoc facilitate patients seeing the same practitioner and encouraging better relationships, as often the practitioners have varying shifts? In other words, has the corporate structure been detrimental for relationships?
That's a really good question. I'd be keen to talk to the person who asked that question after this. I think like among sort of the principles in our company promise is we will never knowingly undermine continuity of care. The challenge for us is we have customers who we have a relationship with, and we also have patients who have a relationship more so with the practitioner than with that medical center or business entity. So we have to try and do right by the customers that we have, which are sometimes corporate medical groups. But we, as much as possible, want to make sure that if you have an existing relationship with a specific provider, that we will make it as easy as possible to streamline communications and book with that person. So I think it's a challenge, like getting those relationships right. But we would, as much as possible, I mean, hope obviously if a doctor like left a corporate group that was a customer, for example, and then went and worked at a medical center that wasn't a customer of HotDocs, it's hard for us to help. But one thing we would never do is we would never like try and undermine that relationship in any way. So yeah, I think like there are going to be examples where we we're not going to be able to like always help that specific practitioner, but that practitioner is very welcome to tell the new business that they are working for, or if they're starting their own business, that they should use HotDoc, at which point we can help them.
Delicately answered.
Yeah.
Got a new one down the bottom. What? Here we go. Can you see HotDoc becoming a source of trustworthy, reliable health information, brackets FAQs, for example, to help counter the dangerous effect of Dr. Google?
I think we can play in that space. What I don't think HotDoc itself should be a content provider, but what I'd love to be able to do is help health professionals create valuable content and information that patients could access, and then potentially create ways where health professionals could provide signifiers of trust to that content. So if like, let's say 50 doctors say, I think this content is great and I prescribe it to my patients, then that probably means that it's really great content that other health professionals might be able to discover and provide. So it's stuff that we talk about. Sorry.
Sort of like a Reddit style system of upvoting quality and.
Yeah, a tiny bit. Like I think the thing that Google doesn't have, which maybe a HotDoc could have in the future, is the opportunity to use the network effect of doctors. Because on Google, if you're a patient and you click on something, that's just as valuable as being a doctor and clicking on something. So if instead you can kind of know that, well, a doctor has said that this health information is really high quality and accurate and up to date. That is a better way of knowing that this is trustworthy information than sort of patients clicking on it on Google. So I think there's definitely an opportunity for HotDoc to participate in that space.
Right, we're still getting through questions. We'll try and smash through a couple more. We've only got 5 minutes or so left. This is a good one, a bit of a pointy question, which I always enjoy. Do you think that at some point you will need to work in the medical field again in a more direct way to continue to improve what you've come up with, improve your platform and understand how the system works?
I think there are other business leaders who are also practicing as doctors or other health professionals. I take my hat off to them. It's just like, there's just not enough time to do that. And I certainly wouldn't want to try and be a healthcare professional to help the business. I think if you want to be a healthcare professional, you're doing it to help patients. But what I think I need to do, and I try my best, but I could do more, is just continually build good relationships with different types of healthcare providers. They're working on the front lines, understand what's happening, what are some of the challenges, and try and incorporate that knowledge into HotDoc. And also like probably start to actually hire people with clinical backgrounds into the business. So yeah, I think my days of a doctor are like a knife, but I definitely think that's an important point. Like we cannot talk to doctors and other health professionals enough.
You mentioned there bringing in expertise. So much of, I think, being a good leader is about knowing your own, not failings, but shortcomings, knowing where it is you need to bring in other kinds of expertise. And you've moved into the tech space. Well, it's a tech business that you're operating. How much did you lean on other people's expertise there, and what was that like?
I think I'm really good at asking people who know stuff that I don't know for their wisdom, and doing it shamelessly. So yeah, that's probably my number one skill in many ways.
Is it
Um,
nice as well? Do you think that that's something that people should be
yeah,
willing to do to humble themselves?
they should. It's like there's this weird thing with humans. If you ask people for advice, they're just so willing to often lend 30 minutes from their day. And I certainly do my best. Obviously, like I'm pretty busy, but like often I get people who, and like people who maybe went through medicine and maybe are thinking about starting a business, and they ask, would you be free to catch up for coffee, or would you be free for a call? And more often than not, I take that because I know I'm paying it forward or paying it back after I did the same with other people. So I think like anyone who's like considering doing this kind of stuff or something new, and in order to do that, you do kind of need to gain information from other people. Just do it.
Yeah. Um, a couple of times I've been asked now, so I feel I can't dodge it any longer. What was the book you were planning to write but that you didn't finish?
So it's about a relationship or a friendship between a prison psychiatrist, who knows who that might have been based on. Yeah, just shrug of the shoulders, and a Vietnamese prisoner who was a heroin addicted drug dealer, and yeah, how like it was both about the friendship that they forged and also the life of that Vietnamese person as they arrived in Australia up until the point where they landed in prison.
Great answer. Thank you. We would all love to know how that story ends. Like we maybe won't.
Well, it's possible. I've promised my mom that I'm going to finish it one day. So it may not happen in the next year or two, but I would love to one day round it out.
I have so many more things I'd love to ask you, Ben, but we are out of time for the session. Thank you so much for sharing your career story so generously with us, and advice as well. We very much appreciate it.
Pleasure. I really enjoyed it. Thank you.
Thank you, everyone else who has joined us tonight. Thank you for all your excellent questions. This isn't the last Alumni Hour. There will be another one before the end of the year. So make sure you stay tuned and keep an eye out for all the details for that next one. And in the meantime, make sure you stay safe. Thanks for joining us.